Well, few things put a new parent on edge like a baby's fever, but many infants do get a fever at some point. And so this morning, we're going to walk you through the steps of just what to do when your little one runs hot. Our guests this morning are Sarita Thapar, Director of Medical Affairs for Actavis, the makers of Feverall, and Dr. Peter Antevy, Pediatric Emergency Medicine Physician, Dimaggio Children's Hospital in Hollywood, Florida. They join us this morning as part of our My Health series, and good morning to you both.
Good morning.
Thanks for being here with us this morning. And Dr. Antevy, I do want to start with you this morning because, you know, all three of my children have had fevers, and I've always fretted over what do I do, what do I do? What is the best way to take a baby's temperature, and how do we know, what is too hot?
We as parents know that when the child is hot, they have that glazed look, they have the chills, any parent will get nervous and will get scared, so that's okay to feel that way. What I would recommend for most parents is if your child is under 3 months of age, use a rectal thermometer. It has to be non-mercury, and make it a digital thermometer. That's the most accurate way of doing it. It doesn't hurt. It's simple to use. Ask your pediatrician, and they can show you. If not, you can use the thermometer under the arm or in the mouth.
How do you know? Because my first instinct is to run them into the ER. Right. How do you know if it's safe to treat that fever at home or if you should take them to the ER?
If your child is under the age of 3 months and your child has a fever of 100.4, that's a time to call the doctor and a time to get some advice over the phone on what to do. Over 3 months of age, really, we look at the number of 103 as being the number to look for. And really, after the age of 6 months is when really the number of the fever is not so important. The symptoms that come along with the fever are really crucial to me as a physician. If you as a mother think that there's really something wrong, you're probably right.
Interesting. Sarita, as I'm sure you do know, there are a lot of over-the-counter ways to treat high fevers and bring down a baby's fever, but what makes Feverall different?
Well, Feverall is acetaminophen, is a pain reliever and a fever reducer for children and infant, and is in a suppository form, so that you can be sure your child is getting full recommended dose. It can be used for children as young as 6 months old, and is available without prescription.
See, I like the idea that it's available without a prescription, because for a lot of parents, when they're worried and concerned, they need something they can get right away.
Of course, and because it's a suppository, there's no need to worry about your child spitting it out, like with liquid medication. And as a mom, that's one less thing you need to worry about when your little one is not feeling well.
And you're not just a mom, you're mom of 2 sets of twins, my dear. So
yes,
for you.
I have 2 sets of twins, and my older sets, when they were babies, one of them just would not take liquid medication. He would spit it out, and I wasn't sure if I was giving him the right dose. And then I tried the suppository, and it not only reduced his fever, but it was just a big relief for me. And there was no fuss, and I know he got an accurate dose. And since then, never gone back to liquid.
Never gone back to the liquid. Well, doctor, let me ask you then, how do we know what is the best way to go, if we should be giving a suppository or if we should be giving the liquid?
Just like Sarita said, every child is different. My older boy takes medications wonderfully. My younger one doesn't. It depends on the child. From an emergency room perspective, children who come in who are vomiting, maybe have a gastroenteritis, children who are just not wanting to take anything, not even liquid, and those children may have a fever, you can go ahead and administer the suppository. We use it all the time in the ER. We love the medication.
And I was going to say, Sarita, that a lot of parents may be a little bit uncomfortable with the idea of giving their child a suppository. And I have to say, the first time I did it, I was. But at the end of the day, I'm like, this didn't hurt him at all. He wasn't uncomfortable. It wasn't a big deal. Is this difficult to administer?
No, not at all. As you say, I know some moms get nervous for the first time they use it. I was the first time I used it. But it's very easy. It's very easy to administer. Each suppository is conveniently wrapped in a plastic. I have one here. You simply peel apart the plastic wrapper to open it. And with your baby lying down, carefully insert it into the rectum according to the printed direction. It's very easy, very easy, especially when your child is fuzzy or sick. This you can even do it during the diaper change.
That's a great piece of advice, because you're already changing their diaper, and it's so quick and easy.
And they won't even feel it. Yeah.
I really like that. Is there anything else, though, that parents should know about this medication?
Yes, like with any other medicine, Feverall should only be used according to the directions on the label. If you have a question, ask your doctor or pharmacist. And if Feverall is acetaminophen, so if your child is taking the suppository, make sure that you do not give any medication that contains acetaminophen. And there's such a peace of mind knowing that your baby is getting what they need to feel better. And with the suppository, you're always getting the right dose.
And that's such an important thing. Yeah,
such a relief.
Doctor, anything else that you wanted to add?
Yeah, I would say that we see lots of children in the ER. I worked a shift last night where we had a child who basically wasn't able to take anything by mouth, had a very high fever. We conveniently and rapidly placed a suppository. Fever came down very nicely. Child looked great. We sent him home. Oh. It was really nice.
There you go, wrapping it up.
Bit, yeah,
in a nutshell. And it's funny, I was just sitting here thinking, what do we have, 9 children between us? So we'll get a lot of use out of this Feverol product. Thank you so much for being with us and sharing it on the Balancing Act this morning.
Thank you.
And you can find Feverol at pharmacies nationwide, and no prescription, as we said, is needed. So it's a really good thing. To learn more, simply visit Feverol.com.